Welcome to SorWil Solutions, where we talk about what's going on in our community. I'm Joe Wilson, CEO of SorWil Technology Solutions, and today my special guest is Stevie Durkin from the Guidance Center. Welcome.
Thank you for having me.
We are excited to have you. I have announced your name on this podcast as being our upcoming guest multiple times, and then we've had to reschedule. So
That's on
I
me.
appreciate you staying and making sure that this worked out. It's
my
super
apologies.
important.
That's 100% on me and a hectic schedule. So I appreciate the flexibility.
But you're busy. You have a lot going on.
We do have a lot going on.
I was over at your office with the United Way board.
Yeah.
Recently, we got to take a tour. You guys are doing fantastic things over there, and I've heard nothing but good things.
Oh, thank you. Yeah. It's an incredible group of people to work with. And so I'm excited to be able to talk a little bit about the work that they're doing. So
you've been with the Guidance Center now for roughly 16 years-ish?
So it's actually a little bit different than that. So I started at the Guidance Center in 2008 as a practicum student. And then I stayed with the organization until 2017. And then I made a shift in Atchison to what was then called the Atchison Community Health Clinic to take over as the CEO there. But I came back to the Guidance Center in August of 2024.
Okay.
Yeah.
What's it like being the CEO of the Guidance Center?
Oh man, it's an incredible privilege first. Like it's an honor, humbling to even be considered for a position like this. But it's a unique opportunity really to represent. I mean, it's a blessing to be able to represent our team, to be able to come and do things like this and talk about the tremendous impact that they're having in 3 different communities that are different. So, but at the organization that I left in 2017, I loved it. And I came back to an organization that's not completely, in a lot of ways, very different. We just expanded. So it's an honor.
You guys are always busy. You guys are getting involved with law enforcement, the schools. I mean, in ways that I can't imagine anybody ever anticipated mental health getting involved.
Yeah.
What's that been like?
Well, I mean, so the first thing, I just would love to hit on the idea of like how valuable partnerships are. Like it's an incredible opportunity. So those were expansions that kind of already took place at the Guidance Center before I came. So to be in the schools, and so I had to write these down because we are in so many schools here in Leavenworth and Jefferson County. And you may wonder why we're not in schools in Atchison County. My responsibility when I went to the Atchison Community Health Clinic, we started a school-based mental health program while I was there. But we're in Tonganoxie High School, Baser Linwood High School, Lansing High, Leavenworth High. We've got 2 clinicians there. Richard Warren, David Brewer, Anthony. We're in all of those schools here in Leavenworth County. And then we're in the Oskaloosa School District and Jeff West School Districts in Jefferson County. I was really excited. And I know one of the things that the staff were extremely excited about when I came on, that they had already started like this liaison position over with Sheriff Dedeke and his team. Individual there, Jeff Robinson, tremendous guy, working as a liaison for individuals that are incarcerated, trying to line them up with treatment. We provide treatment in the jails too. Co-responder model with Andrea Kessler, and I've got some data there that we can get into a little bit. So it's just really impactful to see partnerships. I'm a big believer in collaboration. So that's been a tremendous advantage for our communities, I think.
When we visited with the United Way board, you had talked about that. And I found that so impactful because having been in law enforcement, we didn't have mental health responder. We had to respond to those calls. We had to handle it as best we could, try to be police, mental health and all that. And it's not an easy job. And knowing that there are resources now is amazing. How do you find the resources to staff these positions? Because I imagine that's got to be difficult.
Well, a lot of that, most of it is off grants. Like we get through partnerships in the community with corrections and different places like that. We'll access grants to support that line of work because really those positions, we can't cover it through an insurance reimbursement mechanism. That's just not applicable in those scenarios. So we've got to find grants that allow us to expand and offer different lines of service. So that's how we've got those off the ground. Now the school-based clinician positions, like we're billing insurance out there. We're working with kiddos that maybe don't have insurance, so that's a little bit different than the the models with law enforcement. So,
how different or how big a jump is it to go from being a caregiver to now leading the team?
Yeah. Do you mind if I go back and kind of
Please.
tell a
Yeah,
little
go
bit?
ahead.
And I don't
I'm
want this to
interested.
sound self-serving at all, but I
Sure.
feel like I've got a little bit of a unique trajectory
Okay.
in mental health. And so I'm going to take it back to where I went to college and undergrad was Pittsburgh State University.
Okay.
Go Gorillas. There's a lot of gorillas in Leavenworth
There
County. I love
is.
that.
Yeah,
It's growing in
yeah.
Atchison County too. But I went into Pittsburgh State University and I was one of those students. I didn't necessarily know what I wanted to do. And so I was kind of putting feelers out for a lot of different things. I went into marketing, broadcasting, advertising, things like that. Nothing really felt like it landed with me. And so me and a group of buddies, we moved into a house together. I don't miss those times. I love those guys, but don't miss those
Probably
times.
stories you can't tell.
Right. Don't miss those times. But we moved into this house, and the landlord came over, and we're like literally like lugging in boxes. We're moving into the house, and he said, "Hey, any of you boys need a job this summer?" I said, "Absolutely, I need a job." And so he said, "Okay, go over to the fact building." And I didn't know what the fact building was, but long story short, I went over to this building and I started. I let them know who I was and who sent me. And at that point, I figured out that the CEO of the mental health center in Crawford County was the one that was sending me over there. And so I didn't mean to name drop first day walking in there, but I inadvertently did that. But how that turned out is I started working at the mental health center in Crawford County, working with high school age kids that were, experiencing some mental health challenges and needed some extra supports. And I fell in love with that job. Like it was the first time that it really felt like, all right, when you go home at the end of the day, like you made an impact with kids just by developing a relationship. And so I worked there through the rest of college, and I did some case management. I did some attendant care, which is all stuff that the guidance center is doing. And so through the years, I've worked at a lot of different levels of community mental health. So when you say what's it like to make that jump, like it's a humbling thing. But I really feel like my experience has led me to really understand a lot of the roles and what it's like to be a caregiver, which is so incredibly impactful. But it's a lot of really hard work. It's a really impactful position, but it's a lot of hard work. Like that emotional exchange is so incredibly valuable, but it takes a lot of energy to be able to do that. So to come back to the guidance center and work with a team of individuals that I know are mission minded, just like they were at the Atchison Community Health Clinic, like being around individuals like that make it possible. You know what I mean? Like it's to understand why we're in this, why we're doing what we're doing. We're doing it for something and a reason that's bigger than me as Stevie Durkin or any other staff member in the organization. Like we're here to make communities healthier. So to come into this role, like it's certainly a challenge, as it should be. But I lean on the idea. It's such a privilege to be able to be in a role like this and to interact with community members, to just learn more about our communities and what we need, and how do I work within the system that we've got to try to make those things better.
I was a psychology student at KU for a while.
All right, fantastic.
I did some volunteer work at the VA.
Okay.
I worked with Bert Nash and kiddos. And then I volunteered at headquarters in Lawrence, which is the suicide hotline.
Yeah.
And that's when I realized I wasn't cut out to be a psychologist or a therapist. Because that when you talk about the emotional taxing, it is highs and lows that I don't think anybody can ever understand that's never done that. And talking to somebody that ends up killing themselves or, is racist or whatever. I mean, it is. So I admire people who get into it and can stay with it. But I can't imagine what it's like to unpack at the end of the day.
Yeah. I mean, I appreciate you saying that. That's really cool to hear your kind of background with headquarters and Bert Nash and all of that. It's hard to explain. I mean, it really is. It's just very, very hard to explain. And so being around individuals that want to care for one another, I oftentimes at the Atchison Community Health Clinic and now at the Guidance Center, I really kind of phrase it in a way for our team. Like, look, it's a requirement that you take care of each other too. Because you are going to have those days. You're going to have a really rough session or you're going to have a really poor outcome. And the emotional impact that has on people, because we are authentic individuals, right? Like we are sharing an emotional space with people sometimes at their lowest moments.
Yep.
And we're trying to lift them up. And if you've been around anybody in your personal life that's kind of like struggling and what that's like to just sit there with them. Like that's an incredible trait that an individual can sit there and share that emotion that's maybe not ours as a primary emotion, but like we're sharing it with you. We're in that space. Is an incredibly just it's an impactful space to be in, but it's hard. So we try our best to take care of the individuals that are on our team, and we're going to continue to advocate for changes within our system that allow us to take better care
Mhm.
of our individuals on our team. So incredibly proud of them. Been there in a lot of those positions, so to have that firsthand experience, I think is helpful in the role too.
And I don't want to go overboard here, but
Sure.
I don't know that people really understand, you know, what it takes. You're not getting rich doing this,
Mm.
unless maybe you go into private practice and doing this. These are people that are interested in people,
Yeah.
and they're going to work every day trying to make a difference, literally because they want to make a difference, not because they're getting rich. So I want to hammer that point home because I really think sometimes people lose sight of that.
Yeah. Yeah. No, I agree 100% with that. So yeah, it's definitely it's a calling. It's a
Yeah.
calling to be in these fields. So yeah.
We have a unique community. We have a homeless population. We have the VA here with vets who are struggling on a regular basis. You guys see a whole lot of different clientele pretty
Yeah.
regularly. Who is the most difficult to work with?
Oh, I mean, I don't know that I would frame anybody as difficult to work with. For sure. I mean, I think that you've got individuals across the spectrum that are
Uh-huh.
just at of uh, different phases of their wellness journey, right?
Sure.
So some have some barriers getting in the way of accessing care, maybe some internal resistance, maybe some external resistance for them accessing care. But in community mental health, oftentimes I will say I feel like all mental health professionals, because private practice, there's certainly a space for them, and they do tremendous work out there. I feel like everybody should work in community mental health at some
Yeah.
point. And I would strongly advocate at the beginning of your career, work in community mental health because you see such a wide variety of individuals and backgrounds. And like it's a tremendous vantage point to just understand kind of human beings
Yeah.
and all the things that go on in individuals' lives. So community mental health is that. Like you can have one session that may be specifically focused in on some depression or some anxiety, some generalized anxieties, something like that. Certainly don't intend to dismiss any of that. That's
Sure.
important stuff. But then you may have somebody that's dealing with, they've been incarcerated or
Mhm.
abuse history, or like it's just such a wide spectrum of needs. And so it's our opportunity and our kind of role to just kind of be open to whatever that individual needs coming in. Now, I will say that there are clinicians out there and case managers and all recovery service providers that have like maybe an area of interest that they kind of lean towards or a
Mhm.
certain age bracket. Community mental health, you can't always do that. I can't always do that. You don't always have the number of staff to be able to. I don't want to say pick and choose, but kind of like specialize a little bit. So there's that. But so yeah, I mean, I think that each individual is just unique. Each individual is unique.
We live in a time where it's become accepted to discuss your mental health
Yeah.
and to seek support. I come from a time early on where it was rub dirt on it, stuff it down as far as you can, you keep going. In law enforcement, the thought of ever at that time, and my father was a substance abuse counselor, so I used to talk with him. But early in my career, it wasn't. You didn't talk about these things. You just stuffed it away and you kept moving forward. What do you think has caused this shift in our views on mental health?
Yeah, no, that's a good question. And I don't mean to smirk at the idea if
Sure.
you caught me smiling
Yeah.
at that, but there's a thought behind that, and I'll share that here in a second. I mean, I feel like that's kind of the similar background that I had. Like you
Mhm.
just kind of like pull yourself up by your bootstraps. I don't know
Yep.
how many times I heard that saying through
Yep.
grad school and the challenges behind that perspective. That's something that's kind of it's just changing in a lot of really great ways. And the reason that I was smiling is because I feel like it's these kids, like these kids, young adults now, that are just kind of like, hey, mental health is health. And they're willing to have this conversation. And so, in a lot of times, and I'll just speak from my own clinical experience, a lot of times it was kind of like getting parents on board with the idea of your kiddo's ready. They're ready to explore these things. They're ready to talk through these things. Let's create space for that. And so working with the parents, but I also think that a lot of times parents had this idea that if someone needed this treatment, that meant that they did something incorrect. And like we all know, like parenting, like where there's no manual, right? Like you're doing the best that you can. It's no indictment on a parent at all. So once you kind of got them to a space where they could acknowledge it's like, this is just what's needed. It's what's needed. And the idea of not tuning into what's needed and avoiding that just creates ongoing issues or other things, that resentment that may come up or whatever. But I think it's this younger generation that are just willing to say like mental health is health. And I think that's fantastic. And I'm proud of this generation. Not that they need my acknowledgement, but like I'm proud to be witness to that generation that are advocating with their teachers, and the teachers creating space for that conversation, but advocating within school programs like we developed, right? Like they're willing to say like, no, we'd use that. We'd like to have that. And so that shame or stigma that we've been challenged to kind of get rid of for so many decades, it's still there. There's work to be done, but like we are making progress. And I think it's this younger generation. I love that.
It's interesting you say that. I had a conversation with Chief Kitchens, and we were talking about this new group of law enforcement officers, and how, they're willing to say when they need some space or a mental health day. And he applauded them for that. And he made the comment that when we were coming up, that just wasn't available. And so he thinks that's a good thing as well in law enforcement. I just think it's very interesting, as we try to get away from the stigma. And my son attended therapy when we were in New Jersey for a while, and his counselor referred to it as a stigma about not wanting to get him certain treatment because he would get this stigma attached to him. And so that was, as a parent navigating these waters, it's difficult because every therapist has a different view on things.
Sure.
And so trying to find support, and I'll be honest, as we go through this journey with my son, trying to find help for him, especially after COVID has been difficult because people want to do things over Zoom. And I just don't believe that anything productive happens over Zoom. I saw Zoom school completely unproductive.
Right.
And so I'm excited to see that you guys have expanded services and that you guys are starting to be really successful and that you're so involved in the community. So once again, I applaud you. I know that it's a tough road and that you're going to have some struggles there, but finding the right people, I think, is probably your biggest challenge.
Yeah. Can I share a couple thoughts?
Please.
You brought up some great points there. So one, talking about Chief Kitchens and Sheriff Dedeke and the Sheriff Lori up in Atchison County, them allowing space and time for their teams to come and take part in CIT training that's led by Andrea Kessler and Jeff Robinson, and in a partnership with the Guidance Center has been helpful, I think, in just understanding what mental health or mental illness is. So that's one point that I want to make too. The other thing that came to mind when you're kind of describing your son's journey and kind of going through that, it is, and I know you're not asking this, but I think it's so important to kind of highlight the idea of mental health and therapy and treatment. Find the right provider. Advocate for yourself. Like if that, and it sounds like that's what you all did, but like finding the right provider is part of treatment, right? Like, so that relationship has to be there. It's formed off that relationship. So feeling like, therapy may not be a fit, that's okay to acknowledge that. Like, I'm not everybody's cup of tea for sure. And so we don't take it personally, but that's a good sign when somebody's willing to advocate for a change in their clinician to somebody that may fit a little bit better. So I think that's part of the journey too, but and you guys didn't, and I love that. So for individuals out there, don't let a provider that doesn't quite feel like the right provider stop you from continuing treatment. Advocate, change, And whether it's at the guidance center or somewhere else, like we just want wellness. We want what's best for the individual. So I just wanted to hit that.
I appreciate that.
Yeah.
One of the things that when I was doing my research, you guys serve people regardless of their ability to pay.
Mhm.
How does that work?
Yeah, so we don't let insurance get in the way. Whether you have insurance or not dictate whether you get treatment or not. Now, this is there will be some kind of ongoing evolution for the guidance center in respect to this, but we have a sliding fee scale. So individuals that make certain income, they meet thresholds and they provide proof and all of that. We will slide fees. So we want to get a little bit more stable in how we're implementing this program so that we can communicate it more effectively to the community. So that's going to be a goal in 2026. And I know that's a question on there, and that's regarding like the accessibility piece. But we don't let insurance get in the way of whether or not somebody can get treatment. And that's one of the beauties about CCBHCs, and but it is part of that evolution for the guidance center that we need to stand more strongly and firmly on.
What is the source of most of the funding for the guidance center or community health center like the tours?
Yeah, so the majority of our funding comes from insurance billing.
Okay.
So like I would say roughly 80% of our budget is based off of Medicaid and billing and the services that we provide. So we're out there, we're providing services, we're submitting insurance claim, and we're getting reimbursed. So that's the majority of it. We do have some state level funds, and I know this is a question in there too for like guiding lights. We have a $1 million grant that comes from KDADS to help support guiding lights because 80 to 85% of those individuals that access that facility for treatment are uninsured, which means there's no reimbursable mechanism that we can trigger to make sure that that's self-sustaining. So that's a partnership through the state. County funding is another one. So Jefferson County is a funder. Leavenworth County is a funder. Atchison has backed off the past couple of years, which is unfortunate. But that's through a partnership, we'll figure out what's causing that. And I know counties are in a difficult position all over the state, all over the country. So through all of that's kind of what pieces together, our budget. We'll have some private foundations that will make donations to. We'll have private individuals that will make donations as well. So I think really for all of those, as we move forward, I want to be in a position, and I know individuals within the guidance center want to be in a position where we're telling that story of who are our supporters, how we are funded, what that looks like. Transparency is key. Like we are good stewards of public dollars. We will always be. Always have been good stewards of public dollars, but I think that requires a level of transparency too. So majority of it, commercial, Medicaid insurance billing. So
you brought up guiding lights because that was my next question. Can you talk a little bit about that?
Yeah. So guiding lights, I believe opened in February of 2023. That is overseen by our crisis director, Chloe Grabansky. She's done a tremendous job over there. That's another really, that's a hard line of service. But they serve individuals 18 and older, so adults, and they're a crisis stabilization unit. So that kind of means like you need a higher level of care, but you're not at the point where you need inpatient psychiatric admission. So it could be so if somebody needs to involuntarily go to the state hospital, they're not going to qualify for guiding lights. This could be somebody that knows that they need treatment. There's some suicidal ideation, things like that, and we're going to provide supportive services until we can kind of wrap outpatient services around them to make sure that they've got therapy, case management, those kind of things. So there's that's a growing need, and I think that's as part of our effort. That's another line of service at the guidance center that Northeast Kansas needs to know more about. And we'll work on that. So that site serves Atchison, Leavenworth, and Jefferson County. And I'm probably going to mess up the counties here. So, but it's also Donovan, Brown, Nemaha, Jackson. Thank you. Jackson County. And so initially there was a lot of county support in this area to kind of help with that. And as I mentioned, Jefferson County and Leavenworth County have continued to support that. But it's a need. I don't mean to go into other stuff, but inpatient psychiatric hospitals, there's not enough beds available a lot of times. So to have this intermediate kind of level of service that's more appropriate is a really huge help to the local communities.
But you guys don't provide inpatient services.
No, it's not an inpatient facility. It's all voluntary. So yeah, it's definitely different.
Is there anything in Leavenworth County that provides inpatient services like that?
No, no. It sounds like there was some work in that direction a few years ago. I don't know all the ins and outs on that, but that didn't end up coming to fruition. There wasn't the guidance center
Sure.
on that, but yeah, that was sounded like there was a need identified, but just didn't end up coming to fruition.
We spoke a year ago and we talked about the delays in people being able to get appointments.
Yeah,
I'd asked you this question during my run for county commissioner.
that's right.
That has changed since then. You guys are able to get more people in now. Is that right?
Yeah. Yeah, I'd love to give you a different answer this time, for sure. So yeah, so I had each of our clinic administrators. So they oversee all the operations in Atchison, Leavenworth, and Jefferson County individually. And I asked them to kind of give us a rundown now what it looks like to get an intake. So as a CCBHC, which is something that we changed to, we're still a community mental health center, but we're a certified community behavioral health clinic at this point. We have a requirement to see urgent intakes within a day or two. So we meet that criteria in all three locations.
Let me interrupt you real quick. What is defined as an urgent intake?
Kind of a crisis situation, maybe some suicidal ideation, some really significant kind of stress going on within the family. There's probably a little bit of subjectivity to that.
Sure.
But those we will see within a day or two. And the average intake for Leavenworth County is 1 week. Now, I know that when we talked, like we were talking like weeks, if not months, maybe.
Yes.
And so
I made a post about it, and that was the biggest comment that I received on that post. Is while you guys do good work, it takes forever to get in.
Yeah. Yep. And so in a lot of that, we'll get into the reasons for that if you want to chat that through for sure. So we're at a position where in Leavenworth, we're completing 28 intakes each week.
Wow.
Which is great. Now some will no show, right? But we've got 28 intakes available each week. And we're struggling to keep up with that. So I'm going to say all these things. This advancement does not mean that we're done and that there's not growth to continue to have, but that's a tremendous improvement from where we were. And a lot of that is workforce, and we'll get into that too. So in Jefferson County, that's a higher level of licensure. This is always a little bit of a sticking point sometimes, depending on insurance. Like the insurance will dictate what kind of licensure a clinician has to have in order to see you, right?
Okay.
So like I'm a licensed specialist clinical social worker, so I can see more insurance panels than a licensed master's level social worker, right? So just there's a little bit of a difference. So when that comes into play, it does change a little bit of how quickly we can get you in, but we're still within a couple weeks. All other intakes in Jefferson County were at 1 week, but Atchison County, and they've got a new position posted in Atchison County. It was 2 weeks for a regular intake. So each of these communities are different, right? But urgent intakes in all of those locations are within a day or two. So workforce, I'll speak specifically to Leavenworth County, the way that I understand it. So anybody at TGC that needs to correct me, I don't know if we do the hop in the comments and, correct that, but it was a workforce issue. As we were transitioning into the CCBHC program, we didn't have many clinicians. And clinicians, mental health providers, the graduate level trained, doctorate level trained providers are the ones that complete these intake assessments. And then they make referrals to other lines of service. And that could be medication management, case management, recovery service. It could be a lot of different things.
Okay.
But when you don't have enough of those individuals to complete the intake assessment, then you're slowing down the pipeline of referrals to all those other services, right? And so when that team was really low, and I think at one point, in all transparency, I think we were down to one clinician.
Oh wow!
And if you think about that now, we're at one clinician in our outpatient office at that time. But at this point, I think we're around 10, and we've got some new positions posted. And that I don't think that took into that included the school-based clinicians too.
Oh wow!
So like we went from 1 to probably roughly, I don't know, I don't want to say a number because I'll probably get it wrong, but around probably like 20 clinicians. So when you have that availability, you can get people in much quicker.
Sure.
And so that's been a tremendous benefit that the CCBHC program has brought to these counties is our ability to just hire and recruit more people. But it was 100% a major workforce issue.
Had a conversation as we talk about the school program with Superintendent Dr. Adams, and the subjectivity as I talk to people that it almost feels like parents feel like when they send the kid to school, he needs to be taught
Mm.
and he needs to be mental health or serviced in those ways. And the school obviously can't do that.
Yeah.
Having the kids in the schools, how many are we seeing on a regular basis, do you think?
Ooh, I don't know a specific number. I will tell you that each of those providers, so 3, 4, 5, let's say 7 or 8 clinicians
Okay.
that we've got that are focused into school-based programs. They're typically going to carry a caseload of around 35 to 40 kiddos to make sure
Wow.
that they are, their caseload is full. That's kind of the point where, they meet kind of budgeted expectations, which is the
Mhm.
business side that we have to take into account.
Sure.
But yeah, 35 to 40 kiddos on their caseload. And that's just in Leavenworth County. We had a meeting a couple weeks ago with kind of her name's Riley Coker, and she oversees all the school-based clinicians, and she's advocating for more. So
Wow.
we get into this position where there's a lot of need out there, and that's some upstream kind of treatment too, which is great.
Sure.
But continuing to find providers to do that and fill those teams, but that adds up. That's quite a few.
That's a lot of people. It's a
Yeah.
lot of overhead as
Oh, yeah.
well, I'm sure.
Yep.
So for you to try to balance that out has got to be a full-time
Yeah.
job.
Well, and what I love about the school-based programs, and this is, the one that we started at Atchison Community Health Clinic, and what we're doing here in Leavenworth and Jefferson County, like parents are getting squeezed in a lot of different ways too, right? Like a
Mhm.
lot of times people don't have a job that allows them to have PTO or the flexibility to say like, hey, I got to take my kiddo to a therapy appointment over at the guidance center or their own therapy appointment. So by having these providers within the school building, the cut down on the time that these students were out of class was tremendous. So I always use like Effingham, Atchison County.
Mhm.
One of the Dr. Gaddis out there, the superintendent, great guy. We had a lot of conversations. If you had a kiddo that left Effingham to head all the way into Atchison to get therapy, well, you're looking at probably a 20 to 25-minute drive, hour-long therapy session. If it's around lunchtime, we're going to stop and get lunch too, and then you're going to hit the
Mhm.
road back out to school. So you've got a chunk of time that kiddo was out of school, and that's not beneficial to anybody. So going somewhere where the need is, and we can kind of extrapolate this out to other populations too, is just a way that we need to increase our accessibility, and the guidance center has done a tremendous job of doing that. So if there's any parents out there, and I get the concern about like, hey, you're at school, you need to be learning. I mean, a lot of times if a kiddo is struggling with certain mental health issues, they're probably not as present in that topic or that lesson as you want them to be. And we strategically plan around those core courses, and that's all
Mhm.
through the partnership and communication with the school, to make sure that they're not missing out on what they need to be in on. But the time out of class, it reduces it so significantly. I think that's pretty impactful.
So, kids at school, who decides when he needs to see a therapist? The parents have to call in and say, "Hey, I want my kid to see a therapist at school," or
Yes.
does something have to happen at the school for them to make a referral, a
Um,
combination? How does that work?
Express interest. But ultimately, no, like parents have to be in on that. Like
Sure.
there's no treatment that's going to be provided when a parent doesn't know about it. So there's got to be a consent to receive that service, but there does not need to be a certain kind of event, or like suicidal ideation is not a requirement. We want to provide treatment way before that happens. So no specific kind of situation requirement, just an expressed interest. And then there has to be enough need, right?
Mhm.
Like a diagnosable need, something that we are there and we are the appropriate providers to treat. That's got to be present. But other than that, it's communication with the parents, and the parents really are in a position to dictate, what level of care we provide.
Has there been an event where a teacher said, "Hey, we need to talk to somebody's parents because this kid really needs some additional support.
I'm sure. Yeah. Yeah. I think that happens. Of specific situations, I'm not
Sure.
really sure, but I think that probably happens all the time. We really love the partnerships with the school districts.
Mhm.
And again, even the ones in Atchison County, it's the same way. The partnerships with the school districts, those teachers, but those school nurses and those school counselors. That relationship, and when the provider is in sync and communicating a lot, not about information that they don't need to know about. Like
Sure.
certainly the schools have requirements to keep information confidential, but that partnership is just so vital into all of this because the school districts are in a position. Let's talk about like a 504 plan where they're coming in and parents are advocating for, hey, my kiddo needs. So they've got a lot of anxiety and that's impacting their school. Well, the school's being able to say, well, have you thought about this? This is something that's available. Other community providers are available, those kind of things. But that partnership is vital.
Talk a little bit about the support and partnership with the law enforcement. I know that's come about through need. I understand the concept behind it, but an officer gets called to a situation. How does the partner get involved, and when is it determined who determines that they go out, and how does that all work?
Yeah. So I'll be very honest with you. The specifics of like when Andrea Kessler, I'll just kind of speak about the
Mhm.
co-responder model, when she is kind of tapped into and brought out as a resource. I don't know the specific mechanism, but I know it's all constant communication, right? But I did bring a little bit of data on what Andrea Kessler is doing out there,
Sure.
and specifically in the
And I think people would be
co-responder.
really interested in
Yeah,
this.
co-responder model. So this data is from January 1 of 25 until the end of November of 25. But on her monthly report, she's got a year-to-date kind of column, and she's done a tremendous job. She's been called out
Oh my
1,692
God.
times. But I think so. One, that's incredibly impressive. That there's just that level of engagement between the police department and Andrea. Like they're tapping into Andrea and utilizing her expertise.
Let me just ask you a question. She only works 8 hours a day.
I think so. She's got, I mean, yeah, she's pulled out in all sorts of different situations. So she's flexing her schedule. I know, but again,
Wow.
another difficult job.
I think that's amazing.
It is. It is. So, and again, partnerships, right?
Sure.
Partnerships and a willingness to kind of try this and develop it for Leavenworth County has been great. So, but in this, so this is where, in my mind, and this is not what it all boils down to, it's not the finances. Like, that's
Sure.
not why I'm bringing this up. But when we're talking about the level of partnership between departments or organizations in the community, this is where we show that return on investment, whether it's actual dollars that are invested or just time, effort, and energy, right? But she's been able to facilitate 39 admissions. She's diverted from jail 226 times.
Wow.
So when you think about, what that one, jail obviously wasn't the appropriate level
Mhm.
of care, if you want to say it that way, like the appropriate place for that individual to be. So we got them, engaged probably in outpatient services, things like that. But when you look at that partnership and what that means from a financial perspective, that's not the appropriate place for that individual. So quality of life thing wasn't the right place for that individual to be. But then that's if we weren't there and it turned into law enforcement contact, and we know that that's not the right level of care. The law enforcement community has to do what they have to do, right? And so that turns into a cost, right? And it's not the most effective way to go about treating mental health, for sure. Diversions from jail, 226. Diversions from the emergency room. So we were talking about Billy Leonard and the good work that St.
Mhm.
John's is
Yep.
doing earlier. Diversions from the emergency room, 184.
Oh, wow.
Now, I don't know. We can't do like the Joe Rogan. Hey, pull it
Yeah.
up. What's the average cost of an ER visit? Like, it's astronomical, I'm sure. And that's not good for St. John's or Amberwell in Atchison County.
Sure.
When it's an uncompensated ER,
Mhm.
like that's a tremendous strain. But again, that wasn't the appropriate place, and Andrea is able to divert away from those places. Police protective custody is another one in there. So I just feel like that partnership, when you're willing to kind of work together, it allows the sheriff's department, the police department to better utilize their limited resources.
Mhm.
And again, it's the most appropriate outcome for the individuals that we're here to serve. So we want them in the right place. So I think I think that data is impressive. I wish I would have brought kind of 2024 to kind of compare how that's working, but that's impressive data.
It is. Now she supports both the police department and the sheriff's
So
department.
she's primarily with the police department.
Okay.
Yep.
And you have somebody different with the sheriff's department.
So Jeff Robinson is a liaison within the sheriff's department, but we've also got mobile crisis response. I feel like I could take up all sorts of time on your podcast.
Let's talk a little bit about that.
But like mobile crisis response, again, like if individuals are reaching out to like 988 and they're saying, "Hey, you got suicidal ideation," we've got mobile crisis response. When it's mental health related, we send individuals out into the county, wherever they may be, to make contact. Sometimes that's on our own. Sometimes that's in a partnership with the sheriff's department or the police department. But that's another line of service that I don't know that Leavenworth County, Atchison County, born and raised there. So I can tell you, I don't think they're well educated on what that service is. In Jefferson County, the same. But that's something that we're doing in Leavenworth County.
My first time hearing this.
Yeah, there you go.
And we've talked how many times?
Yeah.
I mean, there's so many services you provide, you can't even get to them all.
That's right.
Every time you talk with somebody, I think that's an amazing service. There's been, in being completely transparent, a couple of times we probably could have used that even in my house for my son in his struggles. But I think that's something people need to know about, that there is this resource that they can rely on when they're at their worst. Because a lot of those times, I think those incidents turns into domestics or some type of family violence. And this can prevent that. When you talk about the 266 people diverted from jail, I think that was the number that you used.
Yep, 226.
226.
Yeah.
If you look at $60+ a day while they're in jail that the city is paying, I mean, you can calculate how much money you could potentially saving the city, even in one visit. I mean, that's still a lot of money.
Yeah.
So I'm just fascinated that we've gotten into this and it's actually being used.
Yeah.
Because I think that's an amazing job.
Yeah.
These are people that we would have taken to jail. When I left I'll tell this story. When I left in 2005, the sheriff's office, I was hosing crap off of an inmate in a rubber room. Because he was there, he'd been there for a few days. The only person that they saw was the doctor that comes in, that was doing their best at the time, and had some real struggles and really needed more support than that. That was the last task that I had there before I left to go into entrepreneurship. But that person needed more care than we could provide.
Yeah.
And it's sad. And I don't know what happened after I left. I just think that what you're doing today is a huge blessing.
Yeah.
I can't say that enough.
Well, and I think too, to kind of go back a little bit about kind of where this started, and I won't get into all the details of it. Again, happy to talk to anybody in the community that wants to learn more about it. But I know you sat through some of this stuff. But as
a couple of times, and I'm still learning every time.
But as a community mental health center, the guidance center was really in a position where we could do what we could with the dollars that we got. And that's still true today. But Keith Rickard, who was the CEO for 33 to 35 years here at the guidance center, and those directors a few years ago started this change into, I mentioned it earlier, the CCBHC, Certified Community Behavioral Health Clinic status. And that just changed things. It came with requirements. It came as a result of the state of Kansas making a significant investment into mental health. So kudos to all of our local legislators and those individuals that were on board and are still supportive of what we're doing. But that's allowed us to expand these services and grants, but expand these services in the way that we're talking about. So mobile crisis response, that program is a requirement of being a CCBHC. So, the investment came with enhanced services. But yeah, it's certainly been eye-opening to me. I feel like I'm still learning each week about what's going on within the guidance center. I've been there a little over a year at this point. And so to be a community member and try to understand what it's going to take to really educate our community on what all that means, it's just going to take a lot of time, a lot of effort, and a lot of engagement in the community. But we're proud of what we're doing. But the other thing that I want to hit on real quick too, and we kind of got into it with Andrea's number and the co-responder model. The Guidance Center has been very, very good at kind of telling the local community of like client impact stories, right? It's pretty
Sure.
typical of a nonprofit, and it should be proud of those stories. Like, hey, Stevie Durkin got this service. This is the outcome that we were able to produce, and those are really impactful stories. The trajectory that we're on, and for a lot of different reasons, is we also want to tell that through data now too. So, like, I can tell you, and you would have probably had a very similar response of like an individual that we were able to reach in a co-responder model. But some people also want to hear, well, how many of those are happening? And what is the dollars saved
Mhm.
in our local community? Like, that's part of our story too, that we need to start telling. And that's part of our whole trajectory that we're working on internally that I can get into here in a little bit if you have any questions related to it.
So I will tell you one of the things that I tell a lot of people is the ability to get that information out is a struggle.
Yeah.
And I tell this to everybody that's come on, we are learning things on this podcast
Yeah.
that people just aren't aware of. And how do we get that information out there so everybody knows what's going on? Are we taking advantage of social media? Are we taking advantage of
Yeah.
all the opportunities out there to make sure that people understand? And you're right. Once you start telling a story and people can see the financial impact, they're even going to be more supportive.
Yeah.
And I don't think people see the whole picture right now.
Yeah.
You provided some legislative testimony. Why
Yeah.
don't you talk a little bit about that?
Oh man, what an experience that was.
I can only imagine.
Kudos to you for sitting through those what felt like very long 2 minutes, but
Uh-huh.
it was quick. So in the legislative testimony, so we've got Representative Bueller who
Mhm.
was there. We've got Representative Alan Rivas in Atchison County that's part of that committee. What a cool experience that was. It's cool to say that I was done with that experience too. I'll be
Sure.
better prepared as we go into the next time if our association asks me to do it again. But man, what a cool opportunity to just come in and again represent the work that the Guidance Center team is doing. Like I'm in this spot where I just get the privilege to share the work that they're doing. But yeah, we talked about what the CCBHC program has meant to Leavenworth County,
Mhm.
Atchison County, and Jefferson County. And it's trying to encompass all of these new services in a 2 minute testimony after I'm going after like 40 other people that have had their 2 minutes, like literally 40 other people, and trying to capture that. But we want our local legislators in the state to know that this change to a CCBHC program is allowing us to build an infrastructure for mental health that we one absolutely need and that
Mhm.
we absolutely would not be able to do if it's not for the CCBHC program and their investment in on this. And two, what I love my conversations with Representative Bueller and Representative Rivas, like they want to know what it looks like at home.
Mhm.
That's great. What's it look like at Leavenworth High or Lansing High? And they want to hear those stories. They want to know individuals that maybe they know in the community that are high needs individuals, and we're
Mhm.
trying to offer as many supportive services to. They want to know how they're, what the CCBHC program has done for our organizations to help individuals like that. So I love the local legislative engagement for sure. Certainly want to work on continue to enhance that as we move forward. But yeah, we talked about guiding lights there too, and we mentioned earlier, like
Mhm.
85% of those individuals that access guiding lights are typically uninsured,
Mhm.
and so getting them to understand what those grant dollars mean. It means that we've got guiding lights, and so we
Wow.
want them to continue to understand that from a personal and home perspective.
One of the things that I think is really cool is the accessibility of our representatives and
Yeah,
senators to come and talk and their interest in what's going on in our communities and willingness to just hear us out.
yeah,
Um, I I think that's unique to our community. I don't know that for sure, but it feels unique and it feels authentic.
yeah.
This is the final question I'm going to ask before we go to the next segment. I know we
Okay,
have a lot to cover. We didn't
okay,
get nearly into everything that we wanted to, and so we'll have to have a part two for sure.
okay.
Having three different counties under your direction, how do you spend your time and divide up your time so that nobody feels left out?
Oh man, what a challenge that is. What a good question that is too. So I'll just again being transparent. I live in Atchison County. I'm born and raised in Atchison.
Mhm.
Went to Moore Hill, and I've just been in Atchison. My wife too. I am probably with in the local Atchison office maybe once a month. Which
Really?
is it's eye-opening to me. When I took the job, I felt like I'm in Atchison. That's going to be the easiest one to hit. I'm going to Leavenworth every day. That's our home base, right?
Mhm.
In Jefferson County, isn't that far away. So that's something that I think probably all organizations probably struggle to make sure that
Sure.
representation is always there. I try to be personable and approachable to everyone. I mean,
Mhm.
just to field questions. We send out newsletters and all of that stuff. But the in person visibility is something that's a challenge for me, and that's a
Sure.
goal that I have for 2026 is to just be more visibly present. But it's a busy organization. I mean, there are times when I'm based out of the Leavenworth office, as I mentioned, and I feel like I'm in Topeka all the
Oh,
time.
wow.
So it's different. And to also, I think it's also interesting, a little nugget too. When I left the organization in 2017, we were probably at 140-ish employees. We're now at 250.
Oh, wow.
And so like the organization that I left, and what I loved about the Atchison Community Health Clinic is like you felt like you knew almost everybody, not everybody. ACHC definitely knew everybody. But to come back to an organization that's 250 people is just it's a lot of people out there doing a lot of really great work. So that visibility is something that's incredibly important to me, but it is a challenge. So and they're each unique communities too, right?
Wow.
So
That's amazing. We're going to shift gears and go into something a little less heavy, a little more
yeah.
fun.
All right.
Before we do, if people want more information, can you just kind of tell us the website
Yeah.
and who they would get a hold of and all of that?
For sure. So our website is www. I don't even know if I need to say that anymore, but mytgc.org would be
Okay.
the easiest way to just get a broad snapshot of what we've got going on, some of our providers and service lines. Bess Bonowitz, which I know Bess, she's over here in the corner. You can't see her, but she's well known in Leavenworth County.
Very well known.
Yeah, is a tremendous resource to just kind of facilitate any opportunities to really educate the community on
Mhm.
what we're doing at the Guidance Center. I would love to put out a plug. You sat through this long enough. If you're willing to sit through another kind of meeting with me to kind of talk about the Guidance Center, if you have additional questions, would love the opportunity to come out and meet people in Leavenworth County.
Oh, wow.
This community. I feel like I've met a lot of people, but it's bigger than Atchison County. I know there's a lot more people to meet.
Mhm.
So that's those are some ways that you can kind of engage with us a little bit. And then I will, if I can, put out a
Mhm.
little bit of a plug. This isn't available yet, but the
Okay.
Guidance Center is going to be going through a strategic plan
Okay.
and a community needs assessment in early 2026. So we're going to have some surveys that come out to community members. And I can't stress how important I feel like that feedback is. It is so genuine. It's the good, the bad, the ugly, all of it. We want the community's feedback in all three counties: Leavenworth, Atchison, Jefferson County. So keep an eye on our social media pages, please. And when that survey comes out, please hop on there. We hope to keep it within probably like 10 minutes. We don't want it to be too big of a burden, but we do want it to be enough where we're getting a lot of broad perspective. So please keep an eye out on social media for that. We'd love to have your feedback.
Awesome. All right. So now we're going to switch gears and to find out a little bit more about Stevie Durkin.
This is probably the scariest part.
What's your go-to fix for caffeine before a busy day?
Oh, man. I love that. A go-to fix for caffeine before a busy day. I frequent Starbucks more than I should.
Okay.
I'm just going to be
Coffee
honest.
drinker?
I'm a coffee drinker, definitely, but
Hot or cold?
it just kind of depends on the weather.
Okay.
In the morning, usually hot though.
Okay.
But yeah, if I get to Leavenworth, it's usually cold brew. So
Are you up before sunrise or answering emails after midnight?
so I try to be aware of the behaviors that I'm exhibiting to our staff and the impact that or the impression or the expectation that can send to other staff. But I'm definitely an early riser.
Okay.
I feel like 9 p.m. is a socially acceptable bedtime, so I'm that kind of guy.
All right. All right. What's the best piece of advice you've ever gotten?
Oh man. So my mentor, love this lady, Kate Waring. She was the operations director at the Guidance Center
Okay.
for over 30 years. So she and Keith worked hand in hand for many, many years. So when I took over as a clinic administrator in the Atchison office, one of the things that she told me, and she said, whenever the community asks you something, never say no.
Okay.
Okay, so that sounds like this just broad kind of like whatever you want, you're going to get. That's not what it means. So with that,
Okay.
we'll put that on there. But that set a tone for me on how to engage with the community. Like we may not be able to system wise or just capacity wise to do everything that the community wants us to, but it meant be open to the conversation, listen, get that feedback. That's important. There may be something that comes up 6 years from now, and I go, "Hey,
Mhm.
Joe, you remember when you mentioned
Yeah.
that this would be something impactful for the community?" Like, never say no. So don't squash those conversations.
Okay.
Be open to it. The other one that I feel like is really impactful, and I would love to remember this adjunct professor's name, and I'm going to be honest, I just don't. When I was in grad school at KU in the social work
Rock Chalk.
program, Rock Chalk, yes. When I was in grad school, I was, probably at the tail end of my final semester, and that idea of like, okay, I'm going to go out into the community, and people are going to come ask, 4-year-old Stevie Durkin for advice and help was a pretty daunting idea
Sure.
for me. Um, and I remember one day I was sitting in grad school, and she listening to the lecture, and somebody asked a question of like, how do you know which therapeutic intervention to pick? Like, how do you know which one? And there's ways you can do that. But I loved how she answered the question because she said, just remember that no matter which therapeutic intervention you pick, it doesn't really matter. So I kind of had this, it kind of like, made my ears perk up, and I'm like, what are we learning about all this stuff for? But what she meant, and she went on to say, 85% of your outcomes are going to be driven by the relationship that you have with that individual. And the reason that was so impactful for me is I felt like I vividly remember I just kind of sat back in my chair and I thought, I can do that. I can be in that space with somebody. I can make them know and understand that I am genuine. I want their best interest
Mhm.
for them, and I hold that near and dear to my heart. So those two things are probably some really probably the most impactful advice or guidance that I've been given in my career. So
If you were walking into the guidance center and they played a walk-up song, what would it be?
man, uh, at the guidance center, that's interesting. So the question that I have had, and it may be the same answer.
Okay.
The question that I've had, and this was in our association kind of annual conference,
Sure.
Dr. Will Warren's, and a group of us were sitting there, and it's kind of like, what's your walk up song if like
Mhm.
you're going up to bat?
Okay.
And I said,
Yep.
well, I was never. I mean, I'm going to characterize myself as a good pitcher. I probably wasn't that either, but I definitely wasn't a good hitter. But my answer was like, all right, if I'm the closer, right, and I'm coming out of the bullpen, then it's probably All Along the Watchtower by Jimi Hendrix, his
Oh,
version.
wow.
So I
Okay.
love that, but I'm stumped on like if I was walking up at the guidance center, what that would be. So I may need to get in the comments
All
and
right. All
and
right.
offer you another answer. It probably needs to be a little bit more calm than All Along the Watchtower, I would think.
What's your favorite way to unplug and relax?
Oh man, I love music.
Uh-huh.
I love music. I love spending time with my kids and my wife. Like incredibly blessed there.
Mhm.
I have the most supportive wife in the world and family, and my kiddos are just cool and funny human beings. But music's a big thing. I do like to barbecue.
Okay.
Don't ask me if I do it well. I
Every
do it.
man barbecues well. It's
I,
just how well do they barbecue?
that's right. So I have fun with that. I love to fish too.
Okay.
I love sports. I like to read too, but I probably could spend a little bit more time on that too. So,
If you could trade jobs for one day, what would it be?
oh man, I don't know that I would want to. But I mean, like maybe make me a closer. Maybe
Yo, you'll be a
make me a
pitcher. Huh?
closer.
Okay.
Yeah, let's say we're at Game 7 of the World Series and the Royals are back in it, and
Okay.
everybody can shudder at this idea. But yeah, that'd be a cool thing to come
Stevie
out.
Durkin coming out to the mound. Okay.
Yep.
What's a hobby or talent that would surprise people about you?
Oh, hobby or talent that would surprise people. Um, dang, I don't know. I probably shouldn't say. Don't ask me to do it. Okay.
Okay.
I spent a lot of time on the. I can't believe I'm saying this. Well done, Joe. I spent a lot of time on the road between Atchison County and Crawford
Singing in the
County.
car, right?
Yeah. But it's not singing.
Okay.
It's not singing, but it is cartoon character voices.
Okay.
And I think that, I've got some kiddos that have kind of picked up on that and they want to know
Okay.
how I've done that. And I said, well, it's 5 hours in the car each weekend, coming back up to see my lovely wife and girlfriend at the time and back down. So maybe that's it.
Okay.
Yeah.
Okay. That's interesting.
It's not useful. Not useful. It can be entertaining for the right crowd, I guess.
A historical figure you wish you could have met and had dinner with.
Ooh. Historical figure. That's interesting. So I feel like I want to go, and I don't know that I should, but it's my interview, so
That's right.
I get to say what
Any answer you want.
I feel like a musician. So
Okay.
one that's always really piqued my interest. I've read a lot about, and we won't get into the conspiracies of it.
Okay.
Kurt Cobain.
Oh, wow.
To just kind of understand, like his story is pretty unique. It's definitely got a mental health tie to it. But like just an impactful figure in a really interesting era of music. But so yeah, I'd probably come up with some other ones too, but that's the one that comes off the top. So
what's the one thing you really love about our community?
oh man, the engagement.
Mm-hmm.
The engagement. Like I can't stress that enough. I remember coming to a meeting probably a year and a half, 2 years before I was even lucky enough to have this role. And it was a community meeting that was led by Keith Rickard, and it was Leavenworth Mental Health Advisory Council. I don't know if maybe they were still a task force at the time or whatever. But I walked into the room and I was blown away by the amount of people that were in there. And to me, that signaled, and this is no shade to Atchison County, but I'd never walked into a meeting with that many people in a room that were focused in on mental health. So just the engagement, the willingness to kind of learn about the guidance center. And all of that. So the engagement of this community has been tremendous. In Atchison County, I mean, there are people there that are, and I know it's the same for Leavenworth County. I just know it a little bit different. In Atchison County, just individuals that just want to see the best for the health of their community. So again, I know that's here in Leavenworth. And so there's people that are willing to support efforts in both of these communities in Jefferson County as well. But I think in Leavenworth County specifically, the engagement has just been tremendous.
Awesome.
So, yeah.
I really appreciate having you on. It's been worth the wait. It's been very entertaining and interesting. You guys do a lot of great work that I just don't think you get enough credit for. And so I hope as we get into 26, you find ways to promote yourselves so that everybody sees what you guys really do and the impact you're having on this community. Because I think it's by far quite a lot.
I appreciate the time. And again, I appreciate your flexibility. And again, just an honor for any TGC staff that are listening right now. Just the work that you do is tremendous. I can't thank you enough for what you're pouring into these communities. And so we appreciate the opportunity to come and just kind of share some of that news.
There definitely needs to be a part 2 to this because there's more that we didn't get into. And we went through half the questions that I had on here. So
I told you I get windy.
Thanks for joining us this week. If you enjoy what we were putting out, please like and subscribe so that we can continue to do the work that we're trying to do so that everybody stays informed about what there is of value in our community. Next week, we will have a second visit with Mike Stephen.
All right.
Who will be talking about some of the issues with our county. Thanks again.
Thanks.